Hey, it's Dr. Buck Parker again, and in this video I want to talk about rib fractures. I see a lot of rib fractures on a weekly basis, lots and lots of rib fractures, people doing crazy stuff, just motor vehicle accidents, getting hit by cars, wrecking your bicycle, wrecking your ATV, all that good stuff. So lots of rib fractures going on. So a few things about rib fractures. Now, we used to say that all rib fractures don't need any treatment, any surgery, and they just heal on their own. It's kind of changing a little bit, which I'll talk about a little bit. But at first, let's just talk about kind of what we do for them in general. So first of all, obviously, the more fractures you have, the worse or the more pain you're going to have. Okay, and the less you want to breathe. So this is the number one big problem with rib fractures. Every time you breathe, your ribs move and you have pain. So what we try to do in the hospital, generally if you have one rib fracture or maybe two that are non-displaced, usually can go home with a little pain medication and do okay. If you're a little older, say like 60s, 70s, 80s, you have a couple rib fractures, you have a lot of pain, we keep you in the hospital. Make sure we have a good pain regimen for you to make, when you go home. For when you go home, you're not laying there on the couch like you're not breathing. So that's the big deal. So generally, if you have a few rib fractures, especially if they're displaced or something, even if you're young, you'll probably stay in the hospital for a little bit. Get you some IV pain medication to catch up with that pain, so that way you can breathe okay and you don't develop pneumonia. So that's the big issue. If you stop breathing, of course you're not going to stop breathing, but if you don't breathe deeply, which is what happens with rib fractures, then you can be set up for pneumonia really easy. So we want to protect you against that. So what we do is we give you good pain medication, enough that you can take a deep breath, but not too much that you're sleeping all the time, because then you won't take a deep breath, right? So that's what we do in the hospital. We kind of adjust your dose, and it's when you're feeling somewhat comfortable, the pain is not going to be all completely gone. But when you're feeling somewhat comfortable, you have the right pain medication, the right dose, and taking by pills, because you can't go home with IV pain medication, then you're ready to go home. And as long as you're walking, all the other things, you didn't break anything else, or those things are taken care of, all that stuff. So typically, if it's just a few rib fractures, it's maybe non-displaced, you're young and healthy, 1 to 2 days in the hospital, and then you can go home. The more rib fractures, the more problems, the longer you'll stay in the hospital. So that's that. Now, let's talk about, do I need surgery for my rib fractures? The long or the short is most patients do not need surgery for your rib fractures. Okay, so but when you do require surgery, there are some specific indications for that, and it's a little bit of a changing field right now. We used to say nobody gets surgery for rib fractures. Then we kind of were fixing patients that were only maybe on the ventilator. They couldn't come off the ventilator. They had real bad rib fractures. Now we're thinking about, well, maybe those patients that are feeling the rib fractures move every time they breathe, or they have maybe 8 rib fractures on one side, and there's going to be a kind of prolonged pain with that. Maybe that's good to fix. Those folks, sometimes you get maybe you'll break some in the front and you'll break the same ribs in the back. Then we call that flail chest. If you kind of have some floating ribs in there, we kind of start thinking about maybe that's a good indication to treat those rib fractures with surgery as well. And surgery is just the same as, say, if you break your forearm and it's totally displaced. You go in there, you put a little plate on it to align it. You drill some holes in the bone, right? And you put the plate on or you drill the hole or the screws from the plate into the bone, and you make sure it's lined up good. So that's the same kind of situation with the rib fractures. That's what surgery is. So if you have multiple rib fractures that are very displaced, and sometimes you can have a fracture that's a little displaced. Let's go like this. Let's go in like this. A little displaced like that. Okay, those bones will most likely heal back like that, and it won't be that big of a deal. But if they're like this, right, then you start losing volume of the chest, and you have less area for the lung to expand, then those rib fractures will heal. Most likely they'll heal like that, and you have a smaller chest space on one side or the other, and that's a problem. So we think about going in with surgery and going and putting those back together like that. The other reasons are if you go home, if you say, well, you don't need surgery, you go home and you keep feeling that rib move when you're breathing or something, and maybe it's a few weeks out, you may need surgery to fix that. It may not heal correctly, and then further down the line, if you have chronic pain, that may be an indication. It's a little bit of a touchy area. It's difficult. One surgeon told me, a guy I learned from who I really respect, he said, you know what you get when you operate for pain? More pain. So that's a good thing to know if you're going into surgery and it's just for the pain and we don't have a diagnosis or not really sure what's going on, and you get a surgery for pain, you may end up with more pain. So that's something to think about. Anyway, so that's why it's a touchy subject. You don't want to operate just for the pain. You want to make sure that the pain is going to get better when you have surgery. Because there's also a good line I've heard from a few guys that I really respect, and that's there is no disease surgery cannot make worse. Right? So remember that too. Make sure that you're doing it for the right reason and that you're not causing more problems. So the last one is malalignment, basically, or when the sorry, that's the wrong term. The right term is non-union. Okay, so when the ribs break, all right, and they become displaced. Let me put this right here. So you can see it. They become displaced and they do not heal together. Okay, even if they are a little bit displaced like this, they never heal right together. That's non-union. So that may be a good good reason to have rib surgery as well. Okay, I'm kind of going way out of order, just like conscious stream here. But the other problem with rib fractures is that they'll cause you enough pain to take a lot of pain medication, right? Which makes you then constipated. So a lot of times, most of the time, when we send patients home or even in the hospital, we give them a stool softener or a stimulant or something like that, so to make sure you can go, because if you don't go for like 6 days, 7 days, it's a real pain, right? So you want to make sure if you're taking a lot of pain medication, you also are taking something to help you move the bowels. Otherwise, you're going to be unhappy. The rib fractures will be not your main problem, right? And then the last one, the last like kind of big deal with the rib fractures is that if you're immobile or you're staying home or you're in the hospital and you're laying there and you're like, oh my God, I can't breathe, I can't move, I can't do anything, then that can set you up for what we call a DVT or deep venous thrombosis, or a PE or a pulmonary embolism. And that is a blood clot in your leg that breaks off and travels through the lungs. That's the PE is. The blood clot in the leg is called the DVT, the deep venous thrombosis. And that can get big and then break off and travel upstream through the veins into the heart, and into the lung, and then block the blood supply to the lung off, which means then you're not getting oxygen, right? Because you have less flow, and so you have less oxygen to your body and your brain and all that good stuff. So that's a PE. So we want to protect against that. Generally, trauma patients, or you get hit by a car or you have a car accident, you break some things, your body tries to clot, right? So you have this hyper clotting system going on, and then you lay in bed, and then your blood flow is not as good or it's not as fast, and that's where you can get these clotting things happening in your leg, which is DVT, goes to the lungs with PE. So we like to prevent against that. Usually in the hospital, we give you a prophylactic dose of a blood thinner. Most of the time it's called Lovenox at this time. That's what we're using. And then depending on how many bones are broken, if you have lots of stuff broken and you're not mobile, when you go home, you may have that when you go home as well. So typically if it's just a couple of ribs, you don't need it when you go home. So every medication that we give. There's always problems and side effects with that, so you want to mitigate those that risk. So if you only have a couple rib fractures, you're probably going to be okay. You're mobile when you go home, then you don't need the Lovenlocks. Okay. So that I think that just about wraps it up with the rib fractures. That's most of what I wanted to talk about. The reason I have the wardrobe change right now is that I spilled some coffee on my other one, and I know, and also I look better in blue, I think. So I just decided to do a little wardrobe in between the two. I know that I like a few videos today because I'm all set up. So I figured, hey, let's just do them all right now. Anyway, that's it. Rib fractures. If you got questions, you can find me on the website, on the YouTube. No, we're on the YouTube. Or maybe you're not on the YouTube watching, so I don't really know. Or the Facebook, or drbuckparker.com. Find me and we'll help you out. All right, take care.